Research Medical is a non-profit organization set up to save millions of lives by helping medical researchers see the big picture. Despite the technology available today, medical researchers currently have no means of knowing that other teams are studying the same problems, and no means of sharing the data they harvest from those studies. On their own, each of those studies may not contain enough data to provide conclusive evidence that the problem has been solved. But by using meta-analysis, a different story can emerge. Meta-analysis enables the results of independent studies that are statistically similar to be combined and analyzed as if they were one. Unfortunately, meta-analysis wasn't possible in the case of thrombolytic therapy. For years, heart attack patients were dying due to blood clots, and it was believed that thrombolytic therapy, which is a simple procedure of administering some drugs to dissolve these blood clots, would save their lives. The first randomized controlled trial to test thrombolytic therapy was conducted in the 1960s, but the results were inconclusive. Researchers continued repeating the randomized controlled trials, and by the early 1970s, there were a total of 10 trials with 2,544 participants. Now, at this point, if researchers had been able to conduct meta-analysis on the available data, they would have found enough statistical evidence to prove that thrombolytic therapy prevented deaths in people who experienced heart attacks. But they didn't, and it was only 20 years later, in the 1990s, after 60 more trials on a further 46,000 heart attack patients, that they concluded that thrombolytic therapy worked. This means that in those 2 decades, all the people in the tests that received a placebo and all the heart attack patients outside the tests died unnecessarily. Meta-analysis can be used in any medical field to speed up research and save lives, and that is why Research Medical exists. We intend to be a repository for researchers to share data for the purpose of using meta-analysis. So even if their research was inconclusive, it can contribute to the bigger picture by combining it with other studies. By publishing their findings on Research Medical's database, their work can be credited in the future and on their resume. At Research Medical, it is our mission to avoid unnecessary loss of life by helping to accelerate the medical research findings and aiding higher quality conclusions. Join us today to help us find cures faster and save millions of lives.